Okay, so for our ACL patients, we break it up into different areas. So we're going to start off with pre-surgery. These are our top exercises that we would advise you to do so that your leg and your ACL, your quad, your hamstring is as strong as possible before surgery, so that after surgery, the rehabilitation is a lot easier and your brain remembers all the exercises. Okay, so our first one that we're going to do is our single leg deadlift. Okay, so you're facing that direction. So there's a couple of things that we're looking for here. If you've injured your knee, you really want to regain that full extension, so that's locking out your knee. And then on the other side of it, when you're up tall, you want your hip flexor on, and with your spare hand, you can actually bend your knee in a little bit just to make sure that you get that full flexion in a functional position, okay? So starting up into that position, so you can come near the wall if you want, so you can kind of put your elbow against the wall if you need a bit of balance. So you're gonna go up to start, fully bend, give it a little bit of a pull, happy enough, yep. Now, slide down into your single leg deadlift. So we're looking for a rep of 8 on this, that's an 8 kilo. Hold that position. We're in our bare feet, so we're getting lots of balance, and up you come. Lock out that knee, perfect. So if the left knee is the affected knee, you make sure you're locking it out. If the right knee is the affected knee, you're making sure that you're bending. Does that make sense? Down again, and again, that's an 8 kilo. 3 rounds of 8 with an 8 kilo, start building it up. You'd want to be hitting 16 to 20 kilos on this exercise for 8 and 8 coming up to your surgery. Okay, so our next one that we're going to do is our split squat. So the reason why we're doing the split squat is after your surgery, especially if you're getting a patellar graft, you're going to have weakness in your quad muscle. So what I want you to do is just goblet position, hold that position. So kneel down into your split position to start off. Okay, so if this is the affected knee, and this is the knee you're going to get surgery on, you want to bring that heel back in a little bit closer to you so that your knee is kind of over your toe, because after surgery, you're not going to be able to go into this position for a while because this guy will be injured and you've got your stitches there. So you want to get this quad as strong as you can before, so that when it does start to waste away a little bit, you've gotten it up to 120%, it drops down to 80%, then you can build it back up. Whereas if you're at 80% with weakness before surgery, it drops down to 40% muscle bulk. You see wastage left versus right, then it's just so hard to build back up after. You know, that's one of the biggest things that we see here in the clinic. So up you go, hold, back down, all the way, hold. Don't touch your knee off the ground, just hover, down and stay. Just come up a bit, back down, up a bit more, back down, up a bit more, back down. So you can see the way we're going through the kind of different ranges there. So you're looking for a rep of 12 on that, 12 right side, 12 left side. Is that okay? The next one that we're going to focus on is just hamstrings, because we're going to isolate the hamstrings, because again, if you're getting a hamstring graft or if you're getting a patellar graft, your hamstrings tend to get weak because you can't fully use your knee, especially after surgery. So pre-surgery, we want to look for banded hamstring curls of 12. Okay, so we're going to do the pulse, okay? So in you come. Okay, yeah, come towards me a little bit. That's perfect, that's fine. Now, have the band around. So bend the knee right up, 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 hold. So you can see he's fully bent now, right? I want him to come back to halfway, hold, and then come back in. So you want to do rep of 8 to neutral to in, perfect. 8 of these, perfect. And then what you do is when you've done 8, you go to the outer range. So down as far as you can without the band slipping off. You can tape this band around your ankle as well. And back up to 90. So up to the middle, back down, up to the middle, back down. So you feel the hamstring? Yeah. Perfect. So again, relax. So nice band. We're doing, when your knee is bent at 90 degrees, you're going to do 8 inner and 8 outer, so that you're getting the inner and the outer range hamstrings. So again, 8 and 8, that's 16. On the affected leg, you can do both sides if you want. Next one that we're going to do is wall sits. So wall sits, double leg to start off, sitting down, all the way down, hold. So if this is the knee that's going for surgery, you're going to shift your mind and use a little bit more weight. That's perfect. Can you feel that? Yeah. And then you might be able to build up to 30 to 40 seconds and relax. If you go to 30 or 40 seconds at that, you can maybe try single leg. Okay, so down you go, lift up one leg. That's perfect. And if you can get to 30, 40 seconds and relax, at that, you throw a little weight on, maybe 2, 3, 4 kilos. So again, The whole purpose of pre-surgery ACL preparation is get the muscles that are going to waste away after the surgery as strong as possible pre-surgery.